Hello everyone. Today our health topic is effective ways to lower your blood pressure or lower your hypertension. So medications may help lower your blood pressure. Many dietary and lifestyle changes such as exercising more, improving your sleep and limiting sugar and alcohol could also help. High blood pressure or hypertension often has no symptoms but is a major risk of heart disease and stroke. Most people's target blood pressures will be below 120 to 80 mm Hg. If a person's blood pressure is 130 to 130 by 80 mm Hg is or more, it is high. A reading of 120 to 129 over less than 80 is evaluated blood pressure. This means you are at risk of developing high blood pressure. Your doctor may recommend some lifestyle tips for managing your blood pressure so that it doesn't become too high. Here are effective ways to lower your blood pressure levels. How to reduce your blood pressure. First, get enough exercise. Research suggests that both aerobic and resistance exercise can help delay or manage blood pressure, and that after exercising, blood pressure may be lower for up to 24 hours after. Regular exercise means you regularly increase your heart and breathing rates. Over time, your heart gets stronger and pumps with less effort. This puts less pressure on your arteries and lower your blood pressure. These Centers for Disease Control and Prevention, that is CDC, recommended doing at least 2.5 hours more moderate intensity exercise per week or around 30 minutes a day. 5 days a week for children and teens. The CDC recommended 1 hour of exercise per day. Now, increasing your activity levels. How you increase? Using the stairs, walking instead of driving, doing household chores, gardening, going for a bike ride or playing a team sport. Why is regular exercise good for you? Number 1. Number 2, manage weight. Having additional body weight puts a strain on your heart and cardiovascular system. These can raise blood pressure also if your body mass index, that is BMI, is 224 or over. Losing 5 to 10 pounds can help reduce your blood pressure. It can also lower the risk of other health problems. The 3 key ways of doing these are to move more, eat less, and eat healthy. Number 3, cut back on sugar and refined carbohydrates. Restricting sugar and refined carbohydrates may help you lose weight and lower your blood pressure. A 2020 study compared how various popular diets affected people's weight and cardiovascular risk. People with overweight or obesity who followed a low carb and low fat diets saw their diastolic blood pressure fall by an average of about 5 mm Hg and their systolic blood pressure by 3 mm Hg after 6 months. Now, what is the difference between diastolic and systolic blood pressure? Is it safe to follow a no carb diet? Now, best foods for high blood pressure. Number 4, more potassium, less salt. Increasing your potassium intake and cutting back on salt can help lower your blood pressure. A high salt intake can increase the risk of blood pressure, while reducing salt intake lower it. Experts don't know exactly why this happens, but water retention and inflammation in the blood vessels may contribute. Potassium helps the body eliminate salt and easy tension in your blood vessels. High potassium foods include dried fruits such as apricots, prawns, milk and yogurts, lentils and kidney beans, or vegetables such as potatoes, tomatoes, and spinach. However, a high potassium intake may be harmful to people with kidney disease, so talk with your doctor first before increasing your potassium intake. Always consult with your doctor before intake any vegetables or foods. Nutrition labels can help you decide which foods to eat and which to avoid. The Food and Drug Administration, that is FDA, considers a potassium listing of 5% as low while 20% or more is high. Now, my next point is following a heart healthy diet. The National Institute of Health recommended the DASH, that is dietary approaches to stop hypertension, as a heart healthy option. The DASH diet emphasizes eating fruits, vegetables, and whole grains, consuming low or zero fat dietary products, eating fish, poultry, beans, nuts, and vegetable oils, limiting foods that are high in saturated fats and added sugars. Now, what are some heart healthy foods? My next point is limit processed foods. Processed foods are often high in salt, added sugar, and unhealthy fats. They may lead to weight gains. All these factors can contribute high blood pressure. Always remember that. Examples include processed meats, many fast and dried foods, and processed snacks also. Foods labeled low fat may be high in salt and sugar to compensate for the loss of fat. Fat is what gives food taste and makes you feel full. Eating less processed foods will help you eat less salt, less sugar, and fewer refined carbohydrates. All of these can result in lower blood pressure. My next point is quit or avoid smoking. Smoking can affect your all around health, including your blood pressure. In the long term, the chemicals in tobacco can increase your blood process or blood pressure by damaging your blood vessels walls, causing inflammations, narrowing your arteries. The hardened arteries cause higher blood pressure. The chemicals in tobacco can affect your blood vessels even if you are around second-hand smoke. Now, one study showed that non-smokers in areas with smoke-free restaurant, bars, and workplace had lower blood pressure than non-smokers in areas without smoke-free policies. My next point is managing stress. Finding ways to manage stress is important for your health and your blood pressure also. Ways of relieving stress depend on the individual but can include practicing deep breathing, taking a walk, reading a book, listening music, mindfulness, meditation. Get some tips here for relieving stress. Next point is eat some dark chocolate. Dark chocolate typically contains 70 to 85% cocoa, and cocoa contains flavonoids and antioxidants that may help lower blood pressure. These flavonoids may help dilate or widen your blood vessels. However, the American Heart Association notes that while eating a little dark chocolate is unlikely to be harmful, the amount a person is likely to eat per day will probably not provide enough flavonoids to produce health benefits. Now, chocolate that is high in sugar, fat, and cholesterol and calories may not be beneficial. Next point is try these medicinal herbs. Some plants and herbs that people use to lower blood pressure include black beans, cat's claw, celery juice, Chinese hawthorn, ginger root, giant dodder, Indian plantago, river lily, so many things. So there is not enough evidence to confirm that herbal remedies can help manage blood pressure. My next point, that is 11 point, is get quality sleep. Sleep deprivations may increase the risk of high blood pressure. One reason may be that your blood pressure typically dips when you are sleeping. If you don't sleep well, you may not experience this phase. Tips for sleeping well include setting a regular sleep schedule, exercising during the day but not too close to bedtime, sleeping in a cool, darkened room, leaving devices outside the sleeping room, not eating or drinking caffeine or alcohol too close to bedtime. Get some tips on sleeping well. Now, number 12, eat garlic or intake garlic extract supplements. Fresh garlics or garlic extract may help lower blood pressure, and found that for people with high blood pressure, garlic supplements reduce their systolic blood pressure by up to above 5 mmHg and their diastolic blood pressure by up to 2.5 mmHg. My next point, that is 13th point, is eat healthy high protein foods. A 2015 study of data for over 1300 people suggested that people who eat a higher protein diet had a 40% lower long-term risk of high blood pressure, and these who combined this with a high fiber intake had a 60% lower risk. This was true whether the protein was animal or plant-based. So previous studies have already suggested that consuming protein may lower blood pressure in the short term. Now, high protein foods include fish such as salmon, canned tuna in water, eggs, poultry such as chicken breast, lean beef, beans and legumes such as kidney beans and lentils, nut and nut butter such as peanut butter and chickpeas, low fat cheese and other dietary products also. So anyone considering switching to a high protein diet should first speak with a doctor, as it may not be suitable for everyone. It is also essential to balance different types of protein and to balance protein foods with other items also. My next point is take supplements to lower blood pressure. Supplements that may help manage blood pressure include omega-3 polysaturated fatty acids or fish oils, whey protein, magnesium, potassium. However, there is no enough evidence to confirm that most supplements can manage blood pressure. Always check with the doctor. That is always says in my blogs. And using a supplement, as not all supplements are safe for everyone. They may worsen other conditions or interact with existing drugs. Now, my next point is limit alcohol intake. A 2020 review found that consuming 30 gram or more of alcohol appears to increase the heart rate for up to 24 hours. Blood pressures, meanwhile, tends to fall more for the first 12 hours but then increases. A standard drink contains around 14 grams of alcohol. Despite of Thai drinking a lot of red wines is not beneficial for heart health according to the American Heart Associations. They suggest limiting alcohol intake to 2 standard drinks per day for males and 1 per day for females. A drink is 1 12-ounce beer, 4 ounces of wine, 1.5 ounce of 80 proof spirits and 1 ounce of 100 proof spirits. Now, review your caffeine intake. People who usually consume 1 to 3 cups of coffee per day are unlikely to experience a raise in blood pressure. However, your blood pressure might go up if you consume a lot of coffee, or even a small amount when you are not used to it. It contrasts. High caffeine energy drinks may increase blood pressure and with that the risk of cardiovascular problems. Experts discourage the consumptions of energy drinks, especially among minors with existing health conditions. If you find that caffeine is affecting how you feel, you might want to try decaffeinated coffee. My next point is drink water. Some research suggests that drinking 550 milliliters ml of water within 2 hours of waking up and another 550 ml 2 hours before bedtime may help reduce blood pressure. However, more research is needed. Water can boost overall health and may have many benefits. Next point is take prescriptions medication. If your blood pressure is very high or doesn't decrease after making these lifestyle changes, your doctor may recommend prescription drugs depending on your blood pressure level and other factors. Talk with your doctor about possible medications and what might work best for you. Frequently asked questions about regarding this subject. How can I lower my pressure quickly? This will depend on the cause and any existing diagnosis you have. Sitting quietly and doing breathing exercises might help. A person with an existing diagnosis may need to take their prescribed medications if your blood pressure is over 180 to 120 mmHg, or if either of these numbers is over, you may need emergency medical treatment. Can drinking lots of water lower blood pressure? Research suggests that drinking 550 milliliters of water within 2 hours of waking up and another 550 ml 2 hours before bedtime may help reduce blood pressure, but more research is needed. What is normal blood pressure level by age? Normal blood pressure levels by age: children newborn at 6 months 45 to 90, by 30 by 65, children 6 months 2 years 80 to 100 and 40 to 70, children 2 to 13 years 80 by 120, 40 to 80, adolescent, that is 14 to 18 years 90 to 120 by 50 to 80, adult 19 to 40 years 95 to 130 by 60 to 80, adults 41 to 60 years 110 by 110 to 145 by 70 to 90, older adults 61 and older 95 to 145 by 70 to 90. Now, what is the blood pressure levels for a stroke? According to a American Heart Association, if your blood pressure is higher than 180 by 120, you need to seek immediate medical care. This is considered a hypertensive crisis and is a dangerous situation. So, high blood pressure increases the risk for a number of health conditions, and people can often prevent it or manage it at home through exercise, dietary choices, stress management, and other strategies. If home remedies do not help or your blood pressure is very high, needs best to see a doctor. So that's for the end of the video, my friends. If you like my blogs, please subscribe and share it with your friends. And thanks for your precious time for watching my videos. Have a good day.